Hi, everybody. Welcome back to another episode of Ascend TV, where we help self-insured employers lower their workers' compensation costs. Today, we're going to go over a case that involves a worker with arthritis in multiple joints. And there's a very interesting twist on this case, so stay until the end because it is not your typical arthritis case. So this is a 52-year-old gentleman who works as a foreman on a construction site. And he is claiming cumulative trauma from carrying heavy rebar on a daily basis for over 24 years, leading to complaints of bilateral hip, bilateral knee, and left shoulder pain. He was first seen by a provider in March of 2022, and a year later underwent a right total hip replacement. In July of 2023, an orthopedic QME recommended that he get both a left hip replacement and a left total knee replacement. Now, this clinical course cost the employer $178,000 plus to date, and the claim costs are expected to exceed $300,000. So our client hired us to take a look at this case and see where did the case get off track. All right. Now, there are sources. Insurance companies collect information on millions of claims, and so they know how long it should take for arthritis in the hip to resolve or arthritis in the shoulders to resolve. And so for this type of injury where you're talking about pain in the knees, the hips, and the shoulders, should take about 157 days, okay? The cost of the claim should only be about $54,000. And so for claims of arthritis in this setting, it should take approximately 5 months for the worker to get better. Unfortunately, in this case, the claim had been open for 861 days, which is almost 2.5 years. Okay. So there are a couple of things that we found when we were doing our record review. Number one is when the worker showed up to the industrial clinic, immediately he was told his symptoms were not work-related because he was known to have arthritis in multiple joints. It was known that he needed a joint hip replacement, but it didn't appear that there was a comprehensive work history taken during the initial encounter, because one would expect if you've been doing a very physically demanding job, such as what you would see on a construction site for over 20 years, that could lead to joint pain. And so the worker was kind of dismissed and told to go see their PCP. So you can understand how that type of interaction on the very first encounter would put a sour taste in the worker's mouth that would lead to this claim not being closed within a reasonable time frame. Right? So he went to go get a second opinion at another industrial clinic, and the provider put him on work restrictions. And over the next 5 months, did not change the work restrictions, effectively removing him from work. And this is a problem, which we're going to dive into. The provider kept saying, I'm waiting for the records. I'm waiting for the records from when he was previously seen. And how many of us would wait for 5 months to get medical records, right? So it's incumbent upon us to have a little bit of proactivity. And if you're not getting the records, it's okay to go ahead and order the MRI of the joint. It's okay to go ahead and order the X-ray of the joint to get an idea of what's going on, especially if you've asked for the records repeatedly, you're not getting them. Rather than let the patient and the claim just kind of sit there in a holding pattern for 5 months, go ahead and get the imaging that you need, right? Now, during this time, the worker was referred to physical therapy, other allied health services, and reported no improvement in his symptoms. So if someone is coming to you and you know that they have pre-established arthritis, you're giving them conservative treatment and they're not getting better. For what we would presume is, okay, well, maybe you're having a strain in the joint because of your workload. It's okay to say, hey, from an industrial perspective, we have treated the strain or the exacerbation of your underlying condition. It's not getting better. You've been off of work for 5 months. So it's not work that's causing your continued pain. It's your underlying condition. I'm going to refer you back to your primary care doctor. It's okay to do that. Well, within that same industrial clinic, the patient was transferred to a different provider who said, hey, sir, you're older, right? That can cause arthritis. You are obese. You had a BMI of 37. That can cause worsening of your arthritis. And you've been off of work for over 5 months. So we're going to determine that you're at maximum medical improvement, and we're going to send you back to your primary care doctor. So this is the type of provider that understands the interplay between industrial and non-industrial factors and when to take something on as industrial and when not to. And so this provider discharged the patient back to their primary care provider. The worker went and got a third opinion, and that third opinion put the worker back on work restrictions, resumed PT, which wasn't helping the patient get better, and led to this shift where the case ends up staying open for 2 years. Okay. Now, the patient eventually got the right hip replacement through workers' compensation, but the claim is still in litigation, right? And as a part of that process, the worker went to see an orthopedic QME who said 90% of this is due to your job and 10% is due to your underlying arthritis, right? So we get into the chart, we're digging, we're looking, and guess what we find? The worker was diagnosed with Crohn's colitis 10 years prior. He was even hospitalized, right? And so Crohn's is a type of inflammatory bowel disease. It can affect any part of the gastrointestinal tract. And in this case, it affected the worker's colon. Crohn's disease can have extraintestinal manifestations, such as arthritis in the large joints in up to 20% of patients. Crohn's patients can also have metabolic bone disease because they're taking steroids chronically. Because the lining of the gut is not intact, they have problems absorbing calcium and vitamin D, which is important for joint health. And so throughout this time, the patient has been on high-dose steroids to manage his symptoms for Crohn's. He was started on monoclonal antibodies to induce remission. And we know in a small percentage of patients taking some of these monoclonal antibodies, they can have arthralgias. Medical records showed that the patient had weakness, joint pain, cramping when he started the monoclonal antibody. Then he was transitioned to a different medication, a tumor necrosis alpha inhibitor, to try to induce and maintain remission. And in a small percentage of patients taking that medication, they report problems with the joints, arthritis, bone pain. And so over this 2-year history of this claim, none of the treating providers addressed the fact that he has Crohn's disease, which has extraintestinal manifestations such as arthritis. And so he's taking these medications to treat his underlying condition, which further predispose him to having problems with his joints. And what's interesting is the timing of his symptoms in terms of his joint pain coincide with the time that he was diagnosed with Crohn's disease, right? So if someone has been working on a job for 25 years and they start to complain of joint pain, you would expect that the joint pain would have begun relatively soon after beginning the employment, right? Because the job is really hard on the joint, so your joints start to ache. That's not the case with this gentleman. He worked for over a decade without any issues. And around the time that he started to have problems with his joints is when he was diagnosed with Crohn's. Okay. So our recommendation to our client, because this case is already in litigation, was that they should speak with their legal counsel and have them probe that orthopedic QME a little bit more. Why are we attributing 90% of the disability to work-related factors when we know this person has a significant medical history of a chronic underlying condition requiring hospitalization, colonic resections, long-term use of high-dose steroids, other medications that modulate the immune system to try to control the underlying condition? All of those things are known to affect the joints. Why is the apportionment so high in favor of industrial causes as opposed to the reverse, right? 90% of the issue is more likely than not coming from his underlying condition of Crohn's disease. So for all of my physicians and medical providers who are caring for workers' compensation patients, there's this tendency to like breeze through the medication list or breeze through the past medical history especially when those things aren't musculoskeletal, right? Because MSK is the bread and butter of occupational medicine. But we have to go back to basics and recognize that we're taking care of whole human beings. And so, what may be going on in the gut can definitely affect what's going on in the joints. So, I hope you found this helpful. Like, comment, subscribe, and we'll see you on the next one.